Salicylate ingestion, this was previously a more common ingestion. It's much less frequent now, but a lot of older case reports are written about this. You'll see things like oil of wintergreen or aspirin, even anti-diarrheal products may have salicylates, and it uncouples our oxidative phosphorylation, which activates our respiratory center. Symptoms are dose-dependent here. You don't need to memorize the doses for salicylate, just knowing that these are dose-dependent. Our acute signs and symptoms: nausea, vomiting, tinnitus or ringing of the ear, hyperventilation, respiratory alkalosis, and an anion gap metabolic acidosis. I would say that line, the fourth line down, is the thing that you're going to see on your boards. All of these other signs and symptoms are things that we would need to manage with supportive care. So managing hypokalemia, hypoglycemia, potentially acute kidney injury, and mortality can occur due to respiratory, cerebral edema, electrolyte imbalances, or even cardiovascular collapse. We support our ABCs like we always do: activated charcoal if we're within 1 hour, and rehydrating, making sure to replenish our glucose stores. We also replace bicarb, so sodium bicarb is your key here. Salicylates, the reason to do it here is that it would alkalinize the urine and enhance excretion of our salicylates. We can also do hemodialysis for very severe ingestions. Our next audience response question: a 16-year-old female gymnast has been rubbing a minty cream on her sore muscles 3 to 4 times daily for the last week. She presents to the ED with agitation, dizziness, nausea, vomiting, and ringing in her ears. Vital signs are her temperature is 39.8 degrees Celsius, heart rate is 120, respiratory rate of 45, blood pressure 80/65, and our oxygen saturation is 99% on room air. Which of the following would be an expected lab value? A, elevated serum salicylate level; B, hyperkalemia; C, hyperglycemia; or D, respiratory acidosis. And this question it can be tricky because of the electrolyte kind of parts of this, but let's see how everyone did. Yeah, you guys did great. So elevated serum salicylate level, and for B, C, and D, salicylates are more likely to cause hypokalemia, hypoglycemia, and a respiratory alkalosis.